I'm Dr. Okaro. I am a consultant gastrointestinal, weight loss and bariatric surgeon here currently at Eurocare, multi-specialist hospital in Victoria Island, Lagos, West Africa. So I really want to make this video to give a overview of the service we offer, which is the weight loss and bariatric service, which is a surgical procedure service that is really aimed to allow patients to go through procedures that are really aimed to result or create weight loss. Now, as I'm sure a lot of you are aware, the issues of weight, obesity, be specific, and the impact of obesity on chronic conditions such as diabetes, type 2, heart disease, ischemic heart disease, myocardial infarctions, strokes, hypertension, joint problems such as arthritis, and of course, breathing conditions like sleep apnea are very well known. They are talked about quite regularly in a lot of the media outlets. And this is because, unfortunately, we are becoming a population of overweight and obese individuals because of things like diet, access to foods, a lack of physical exercise. But the relevance is that it is significantly interfering with the ability for people to live healthy, functional lives. And if you look at the global stage, you will see that these operations are being performed routinely. I would say about 1 million operations every year around the world. Now, you look at the map and you see that Africa, particularly sub-Saharan Africa, with the exclusion of South Africa, has a massive gap. It's not being done. It's not being offered. And of course, the results of that are people having to travel long distances to, maybe get access to procedures like weight loss surgery or bariatric surgery. And some of us have decided that this isn't a good thing. We want our people, West African particularly, to have access to surgery in their local area. Now, we know that the aftercare, which is a follow-up, the results, short-term, long-term, have a significant impact on the access to seeing the doctor, seeing the nurse, seeing the dietitian. And sort of, I suppose the story I'm here to say or tell today is that so far we're on our 15th year. I started coming to Lagos to perform and run this service 15 years ago. And of course, I'm very pleased because we built a team. We built a number of committed professionals who have really dedicated a lot of their effort and time and energy with the sole purpose of offering safe, evidence-based surgery in Lagos. And this has been a long journey. Obviously, we've had a lot of, I think, good experiences. We've partnered and collaborated with a lot of different people and different hospitals over the years. But I can say, I think, and I really must emphasize that on a personal note, I think that I have, a lot of confidence and also a lot of excitement about what we've got on offer currently, particularly at Eurocare, because this is the place I have obviously centered a lot of my time and effort. And we built a team. Now, individuals in the team are, of course, myself being the leader, the surgeon. We have the anaesthetists, we have cardiologists who are the heart specialists. We have the nutritionists, we have the pulmonologists, and of course the endocrinologists, along with, of course, nurses. And I think the point I'm making here is that this is not something that one individual can wake up and decide that they want to come and set up a service that is going to be credible. It's also going to be, I think, got the relevant processes and systems to ensure that patients have a safe, but also, I think most importantly, a good experience. And I think that I'm very, very grateful, very honored to be able to at least give a report, give my update report in January 2024. That so far we have nothing but good stories. I've dedicated a lot of my time to this. I have committed a lot of, obviously, effort, so have many others that aren't on the video today, for the single-minded purpose of offering safe surgery, safe bariatric metabolic surgery in West Africa. It was, obviously a dream, but I think not to labor that point, I think I need to really talk about how difficult it is, or remind ourselves how difficult it is to build something that's competent and credible. Now, I've done a lot of videos. My patients have done testimonials over the years, just to kind of, again, I suppose, to create that reality, to be able to give patients and, I think, colleagues and others the ability to really tap into some of the things that are occurring. Are you with me? So that people can understand and maybe realize that there are a lot of clinicians and individuals that are really, really, really committed to offering safe surgery in this country. And I'm not doing this to obviously go against the sort of the thinking that medical tourism is here to stay and that we can't reverse it. No. It is reversing. We're having people coming from different parts of the country, from different parts of the region, and also sometimes from different countries into Lagos to have surgery. And that's something of joy and I think pride, of course. But I think it emphasizes to me and my colleagues the fact that you can never take for granted the responsibility that we have to ensure that the things that bring practices down, the human factor, the lack of attention to detail, distractions, and so on, don't find their way into the day-to-day running and thinking of the service. And I have been quite keen to, encourage, I think, but also, I think, remind myself and others about the trust that we have. It's a very honorable position to be in. And I wanted to do an update video just to really kind of remind everybody that the commitment I have personally, but also my team members to this journey remains resolute. So there are going to be some exciting new videos coming out. We've got a whole kind of maybe campaign on now, I think, just to keep things current, but also keep things updated. Simply because things move and change quite a lot. And we do want our patients and our communities to be updated around, obviously how we're thinking, but particularly me, obviously as a person who I think takes the lead to make sure that I think everybody's updated. Now, on a slightly separate issue but linked is that we've now been able to open up a society, an association of bariatric surgeons of Nigeria, which of course has always been a kind of ambition of mine. And luckily we've been able to have that incorporated as an organization. We've had one annual meeting and a masterclass, which I hosted. I've also, I'm quite, kind of pleased to sort of mention that we've linked up with colleagues. I have linked up with a wider West African sort of collaboration with surgeons in Côte d'Ivoire and in Benin Republic, others in Senegal. And really, I mean, what am I trying to say here? What I'm trying to say is that this effort is obviously best done as a collaboration. Standards need to be shared. experiences need to be shared, I think, to gain the momentum. Because I'm really looking for momentum. I don't want patients to have to come to Lagos and to come to the center. I want patients to be able to go to Abuja, Kano, obviously Benin, and other parts of the area, and get safe surgery. There is huge demand, I think. But so now we're quite excited. They've got a lot of colleagues joining, and of course the nutritionists, really important. The dietitians, very important, because they provide the background for the sort of the dietetic re-education. So so really excited, and I hope you have a chance to look at some of the current videos that we put together that just give an update on some of our patient experiences. And I obviously hope to make another video soon and give you some more updates. But thank you all, and thanks for listening. Thank you.